Good evening, tribe. I know you guys have been super excited about this, talking about surviving nursing school with Angie. Sorry about the miscommunication and rescheduling. We had some technical difficulties. Those are super frustrating. So welcome, Angie.
Hi, guys.
So we're going to just do a basic introduction, and then we'll get into how you recommend we survive nursing school. So why don't you introduce yourself?
So my name's I've been a nurse for about a year now. I'm a mental health nurse, and I am in school to further my education for my MSN. And my goal is to get everyone through nursing school without having as many meltdowns as I did.
That's awesome. I love that. All right, so a few people submitted some questions pending our previous meeting last week. So we'll go through those. And those of you that are watching, just go ahead and submit your questions. And as we get to them, I'll read them out. But otherwise, be patient. If I don't get to them right away, we'll do it within the flow of context, okay? So what did you face in terms of hardships in nursing school personally?
I'm sorry, the computer cut out. I didn't understand the question.
Did you have any hardships in nursing school yourself?
Well, personal hardships, yes, I had quite a few. Educational hardships, that's not so much because I used my education to get through those personal hardships. That was my coping skill for my hardships.
All right. Yeah, we all have an area in nursing school that can be more challenging than others. Mine was identifying and labeling the nerves and muscles in the cadaver lab. What did you personally have to give extra effort for?
So in nursing school specifically, mine was first semester, just trying to take it all in and getting through that because I had no idea what to expect. And then after I figured out a method, I was fine after that. But honestly, I had with bowel elimination for some reason. That was the liver and the bowel just were not my friends. So
yeah, we all have that area that just doesn't stick with us, right?
Yeah.
Right. So how did you personally get through that hardship on learning the liver and the bowel and elimination? What did you do to help yourself?
I'm a big fan of teaching to learn things. And that's kind of how I got started with doing what I was doing. Is for me to study, I would study it, I would write it down, and then I would teach it to somebody like my son. So if anyone on here is like on my group and has seen some of the lives, they're familiar with that with Ashton. We would do like some Q&As, and I would my son or I would teach the group of that day. And usually I ended up doing really well on my exams.
That's awesome. That's great. Do you want to talk a little bit about, you mentioned that's how I got started doing what I do. Why don't you tell them a little bit about what you do?
So we have a group that is after today officially 50,000 strong. It's full of student nurses and nurses. We take you guys all in and we offer help, we offer free tutoring, we offer free mentorship, we do mental health checks to make sure everyone's doing okay, and we try to give you guys a place of support and a place to ask questions and not. So
that's great. So similar to what we do here in the tribe, but you guys are 5 times bigger than us, but you also offer some resources. Do you want to talk about a little bit about what those are?
So I make study guides that actually pulls out the pertinent information or the priority information for the exams, and it's all in order and easy to read and easy to follow, and it has NCLEX practice or case scenarios attached to them, and I sell them at a low cost for everyone.
Awesome. So if they want to get those, we'll put that information after the Q&A. We can put some information in the talk here. So a specific question was asked about how can a person study better for med-surg nursing?
Okay, so I'm gonna be one of the study guides. So I have one that I printed just to make sure the colors were right. So this is it. It's a little bit beat up, and it has my husband's name written on it. This study guides. So this is a CNS study. The same. So you do it like a concept map. So you take the pathology or the pathophysiology, just a couple of sentences, and then you learn what you do for it. So the treatments, the risks, the treatments, risks, the signs, and they actually have mnemonics on them, ones that I made up for you guys to remember. Like for the liver, it says the function says Mr. Liver. So we do that and do it in a concept form is how we do it.
So I made it to where you were just being seen by yourself so they could see the concept map a little bit closer. But so when you were in med-surg, were you actually creating as a student to help yourself learn?
So originally I actually started creating I wanted to create them to share with my class because a few of my classmates were struggling, but they didn't really want study guides. They didn't, whatever. So I was like, fine, I'll just share them with everybody else. So, but I did. I used them, and this is how I studied, was a concept. And I believe it's very important to know like how one thing kind of folds into the other. So when you know signs and effects, and usually like what goes up must come down, to make those type of relations with things to interconnect, to connect all the dots, so you don't get tunnel vision and just try to worry about learning it concrete this and concrete that. So we try to make it less black and white because everything's very, very gray. There's nothing ever very black and white about nursing. Very true.
So did you use that same methodology for studying pharmacology?
Honestly, I did. And that's why I say like the method that I'm trying to help students learn, it actually kind of works throughout the span of nursing school. So I know a lot of people say, well, pharmacology is just straight memorization. And to an extent, yes, but it's not, because really it is such a huge part of your med-surg, and it is such a huge part of your daily practice and those cause and effects that I like to talk about, that you can't just memorize pharm. You have to learn pharm, you have to internalize pharm, and you have to live, breathe, eat, and sleep pharm, because you're the last defense against something terrible happening between a medication and your patient. So it is imperative that you actually learn it and not just memorize it to just get through a test.
Agreed. And I really think it's important as nurses, as that last line of defense, we really need to know the why. Why are we giving this? Because mistakes happen, right? Like the doc picks the wrong medication and you end up with I'm going to throw it out there, a liver cirrhosis medication, and you know this patient doesn't have that condition. Why are we giving this?
Right. And you know, even in my line of work, so in mental health, we actually use a lot of cardiovascular medications. We use some cardiovascular, like beta with anxiety. So for me, that was, as a new grad, that's something that that's something I had to learn, because when I first grabbed the propranolol and it said indicated for anxiety, I was like, hold the phone. Yeah. That's not what I learned. Hold the phone. So I called the pharmacy. I was like, hey, did you know this? They're like, well, sometimes they do that, yes, but just to double check, go ahead and call the doctor. And the doctor said, yes, I did prescribe it for that. And that was a teaching moment for him to me. That was his present to me for the day. So, but that's not something I can pass on to my students that are in my group and say, hey, here's something, you can look really smart now when you go to mental health, because it's not like, and don't pull at me and like call the phone. But it never hurts to ask. It never hurts to be inquisitive. And if you don't know something, sorry, my daughter's starting dance lessons and I have to write down the times. So that's why if you see numbers on my hand, it's not random boys. It's my daughter's dance lessons. So So anyway, if you see something funny, speak up, because sometimes, you know, people get complacent. Nurses, it happens. It just happens. Physicians, as many checks and you could be that last person before. So do your friends a favor and speak up all the time. Don't be scared to not know anything or to sound. There's never a dumb question.
Absolutely agree. So another question that came through was, we all study differently. We have several students who have been asking for suggestions on studying. What advice do you have for them? So, you know, some are visual learners, some like to actually write things down. What kind of direction can you give them?
So person, and this is going to sound crazy, but if you do it like systematically in a step and you get yourself ahead of the curve, so you have your syllabus and you have your objectives for each. So if you take like a weekend before the semester starts, exam, to get yourself ahead, go through and get on YouTube. You know, I'm going to give Sarah from Registered Nurse RN a shout out. She has some amazing videos, hands down. And get on YouTube. YouTube doesn't hurt anybody. So learn, at least get a pre-lecture from YouTube. And then you can take the study guide. I took my study guides in. And then if there was anything extra that my teacher said that kind of made it click, I would circle it and I would write it down. And then I would reread. I would rewatch those videos. I would take a bunch of NCLEX practice questions. And then if I still didn't understand anything or had a deficit, I would message we talk about this. And that way you're way ahead of the curve before your exam to hash out all the things that you don't understand. And you know what you do understand, so you can hyper focus on what you don't understand and make that more concrete and do really well on the exam.
That's great input. So you did NCLEX questions with every subject matter?
I'm sorry?
Did you do your NCLEX questions with every subject matter as you went through nursing school?
I did. So we had, in the beginning, before I learned what UWorld was, again, I'm not trying to sell anything because I don't sell like UWorld or anything like that, but it's a great thing to have. So before I knew about UWorld, we had what was called PassPoint or Lippincott Course Point or something point. Okay. And it had NCLEX questions that went along with your book. Oh. So now these questions never showed up. These questions never showed up on our exams. Our teachers knew not to do that. But these questions were very built trained. It's not good to get them wrong. And I know that sounds crazy because we're like, oh my God, we're nursing students, we don't get things wrong. But when you get those questions wrong, you go back and you remediate and you look at the rationale, you're training your brain for a marathon, not a sprint. So that way it's going to connect. Remember that when you go to clinical, and then you're going to remember it when it comes to exam time. So that's why it's super important to get a hold of some sort of practice. There's books out there that you can get on Amazon. There's, if you can't afford UWorld, then there's UWorld and all those other NCLEX type question prep things.
So are all NCLEX prep questions broken down by systems? Like, could you get any of them and search for them, I don't know, digestive system, and you can pull up NCLEX questions just on the digestive system?
So on some of the preps, you actually can. So on UWorld, you can. It's you can break it down, and that's actually how I studied for my NCLEX. I made like a chart, and I said, okay, today I'm studying everything cardiovascular, maternal, newborn, you know, adult med surg, cardiovascular drugs, and anything that has to do with cardiovascular fundamentals. And then I would go through the 12 systems, and then I would take more questions and on and on. But yes, to answer your question, UWorld does have that set up, like so does Lippincott.
Okay. Can you hear me, Angie? Oh, there. Your feed is super fuzzy. I wish it wasn't. I'm so sad. Okay, so someone asked, could a concept map be used in either of the two courses, meaning pharmacology or med surg? And you already answered that. I felt like, yes, you use concept maps for everything, right?
Right. Yeah. I mean, I do. I use concept maps for literally everything, and they've actually become such an important part of my life. I use them before I do anything in the house too. I know that sounds really weird, but I use my nursing process when I prioritize my laundry.
That's awesome. That's impressive. Do you want to talk a little bit about that? Would that help other people maybe?
Honestly, I think it does, because once you start getting that nursing like critical thinking and that time management going, being able to prioritize what's going on in your home and being okay with not getting everything done helps you prioritize school, and then it helps you prioritize. And then the next thing, you're a baby nurse and you're out in the world and in a real job, and you're like, oh wait, I can manage this. I can manage this. Mama needs change, and little baby over here is throwing up. We can do this. Delegation. Delegation is good.
Good point. All right, so let's see. What mind frame should anyone going into nursing school be? And are there different levels of thinking processes to succeed throughout your journey? You pretty much already touched on that just now, but do you have anything to add to it?
As far as the mind frame to go in?
Yeah, she said thinking processes to succeed and, mind frame.
Okay, so what I like in group is it is so important not to go in with fear. Don't fear failing. Don't fear the coursework. I mean, it's overwhelming, yes, but give yourself a day, like sit down, because they're going to tell you everything you're going to go through, and it's going to hurt a little. It's going to hurt, like your heart is going to hurt for a day, but don't do anything that first day. Just come, because you can only do one assignment at a time. You can't do multiple things at a time. And no one's going to be mad at you if you have your baby on your lap or your toddler on videos about the heart, because then eventually your toddler's going to be able to tell you what hypertension is. So don't ever be afraid to multitask with your family, so your family doesn't feel neglected. Say, hey, I have this coursework to do. I'm gonna put a movie on for you guys. I'm gonna sit with you guys while you do the movie. I'm gonna have my earbuds in, but we're gonna still be together in the same room, just doing different things. And that's okay, because that's sometimes what has to happen. Because in retrospect, nursing school is very, very short. Those 2 years or 4 years, they're gonna come and go regardless. So you might as well let them come and go being successful. And tell yourself before you go in this, I can do this. I'm not scared of nursing school. And just know that between your group and my group, you have a place to go to look for support.
Absolutely. And Angie didn't share this with you, but she just finished her BSN and is moving on to her MSN. She's like a career nursing student. It's amazing. So she's got lots of input, and you've done this while being a parent and a student along the way. So you already touched on that. Do you have anything else you want to add about how you maximized your time, whether that was, I don't know, listening to a lecture while watching your daughter's dance recital? Like, how can you maximize your time as a parent and a student?
So, fun fact, one of the hardships I went through during this is actually really funny. So my husband decided we were going to buy a house last October. He decided, and he went through the process, and all of a sudden he's like, hey, I'm like, oh, we are. And he worked 16-hour days. I'm in school, and I'm doing these live feeds, making study guides, juggling all these things. And I was like, crap, I have to pack this 4-bedroom house into another 4-bedroom room. I was like, man. So what I did was I started knowing that I was going to be moving the following week. I asked my instructor, hey, look, I'm not going to have time to sit down and do my normal routine, and I don't like not being in my routine. I was like, so can I just record the lectures just this week because of the move? And so what I did was I recorded the lectures, and I would listen to the lectures over and over and over again, because we had no internet and I was dying. So it's just, you kind of gotta, kind of like the Marine Corps, you kind of just have to adapt and overcome. and think of creative ways to get where you need to go.
That's a good idea.
So.
You can listen while you're doing something else. What about the best way to study for select all that apply questions?
Okay, so those are the bane of almost every nursing student's existence. And even still mine sometimes, I'm like, I don't like this question. But if it's so very, if you're taking a med-surg question per se, like on Cushing's or Addison's, acidosis or alkalosis, think about how that patient, so if the patient is in an acidotic state or an alkalotic state, so are they going to be bradycardic? And start from there. So if the body says low, pick all the words that have the word low in it, hypo, low, brady, and don't pick anything that says hyper. Unless it's, something like for a compensatory mechanism, like with Kussmaul's respirations or something. But very rarely will you see something like that on the NCLEX, much less like nursing school. They'll try to get you with a key one here and there, but it's a good rule of thumb just to stick with how is that patient going to look, like what's going to be low and slow, or what's going to be hyper and going fast. And that's how I got through it, was just how does my patient look.
Okay, great.
And
those are all the questions. Sorry, say that again.
No, and then the true-false method, you can never go wrong with the true-false method.
You want to elaborate on the truth-false method?
Okay, I'm sorry. I thought you knew. So the true-false method is look at the question. So in this state, if this patient's in this state, is this look like? And if you circle it. If it's false, you make it go away. So, and then it also depends on how the question is worded. But that's something we're going to start talking next. Let's see. I think I scheduled it for Thursday. We're going to do our first NCLEX, like a primary, like a prep, and we're going to talk about how to do all of that. So it depends on the wording question is the problem.
All right, good. Well, that'll be super exciting for all of those that are preparing to take the NCLEX. That's all the questions that were pre-submitted. Does anyone else that's viewing, does anybody have any additional questions? I'm not seeing anything come through at the moment. So hopefully people can make out what because it was really choppy here and there. Hopefully we can make out what you were saying. Someone's commenting, I'm in med-surg 1 and farm and dying. Let's see who said that. Heather said she's in med-surg and farm and dying. So
I feel you, Heather.
What's that?
I said, I feel you, Heather. I understand.
Right. For sure. And then Megan's 2 days away from graduation. That's super exciting. All right, Angie, thank you so much for your time. And if you'll just send me some of the links that are applicable to the things we talked about tonight, I'll put them at the top of our Q&A so that anybody that's interested in clicking there can access what you were referring to.
Okay, perfect. I really appreciate you guys having me on here.
Yeah.
Thank you.
I'm glad that you came, and thanks for teaching everybody.
Oh, no problem. If anyone has any questions, tell them to reach me if they need some advice or anything.
Absolutely. I will definitely put it in the description on how to contact you.
Okay, perfect. Thank you.
Have a great night. Bye, Tribe.
You too. Bye.